So barely a week ago, we all heard about the scandal that happened in Nepal, where the ECFMG made us aware that few students from there had their exams and score reports nullified or invalidated because there was a cheating scandal that they suspected in those students' exams. Now, this has been the topic of discussion over the past week, and I know me and you were not expecting to hear anything of that sort. Now, the question is, what actually happened? And to those students who have been who have been, let me say, victimized, or who happen to be victims of the scandal, what is going to happen to them and what is their next step? So that is the reason why I am bringing this video to you. For those of you who do not know me, my name is Jerry. I am a PGY1 resident in internal medicine here in Baltimore. And to issue a disclaimer that I am not speaking on the behalf of my residency program, neither am I speaking on the behalf of the hospital in which I am doing my residency. And if you want to know, I'm doing my residency in the Greater Baltimore Medical Center in Towson, Maryland. Now, let's go back to the topic. So, when this scandal happened, I know we all spoke about it. I made a first video about it, and there were a lot of comments that people made under the video, and there are shocking things that you will hear people say. And if you haven't watched it, you can go and watch it and also leave your comment and let us know what you think about it. Now, I happened to chance on one of the letters or the emails that the ECFMG sent to those students whose exams have been nullified. And this is how it reads. It reads that your performance on the exams listed below raises concern about the validity of the passing results reported. They went further to say that the odds of observing the data that supports the invalidation of your score results during normal testing conditions are extremely low, 1 in 100 million, or even more unlikely. Now, for these students, it happened that the testing happened in May of 2023, and it happened on step 2 CK. And then they said that extremely improbable answer similarities with other examinees testing on the same form at similar times. So it means that for these students, one, they have nullified the exam and they send this email to them. They are telling them that the odds of them finding the data that supports their invalidation is very, 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 very extremely low, 1 in 100 million, and even more unlikely. So because of this, it's like they have no defense. That's what they're trying to say. They have done all their investigations, and they think that there's no way that these students should score such scores, such high scores on the USMLE, very high scores. Some are getting 280s, 270s. But if it's one person getting 270, then it makes sense. But if we are all testing probably in the same exam center or on the same day, and we are getting the same questions correct, and we are testing at the same time, then it raises eyebrow. And this is not one student, it's not two students, it's a lot of students. You see, so this is what brought about the suspicion, and they had to act on it. Now, they're saying that it is impossible for, let's say, 10 students to be testing at the same time and get the same set of questions correct, right? It doesn't make sense. Even to me, it wouldn't make sense to me for 10 students to be testing at the same time and getting the same set of questions correct, and probably even score similar to each other. So it's what brought about the whole suspicion and investigation. So they went further to say that because of the anomalies identified on your performance data, your results for the reference exam, let's say the step 2 CK score that has been listed below. So the score result has been invalidated and will appear on your USMLE transcript as not available, which is okay. But the big thing that will happen to these students is that the USMLE program will retransmit transcripts of all previous third-party transcript recipients with the updated information. So whatever stage these students are at, they are going to have to go a step backwards and come forward again. In the sense that, say, they have submitted their scores to, let's say, a program and have applied, it means that from the day that these letters were sent to them, USMLE is going to nullify their score and also write to the various programs and tell them that, hey, this student's score has been nullified. And that is a big blow. It's a big blow to this student. It's a very, very big challenge, because I know people put in a lot of hard work, a lot of dedication, and they have to go back again and sit for the exams again. Even if they are allowed to sit for the exams again, then I think they still have a fair chance of performing either well or even just at least passing their exams. Now, if it happens that it is going to be listed on their future exams or on their future transcript that they cheated and their exams were nullified, then what's going to happen is that I don't think anybody would want a student who cheats to be in their program, to work with them, because you cannot trust them. You cannot trust such students to offer you the healthcare that you would want, even as anybody at all. So if this is exactly what is going to happen to them, then I'm sorry, it's going to be a very, very big problem to them, whereby they will be labeled, and everywhere they go, somebody knows that they cheated on their USMLE exams. Now, this is not all. Now, the next thing is that, say, any step that these students are on, the step has been nullified. So let's say the student passed the USMLE step 2 and then used it to apply for a residency, then that process is nullified. If they use that to apply for step 3, then because the step 2 is nullified, then the step 3 might also be nullified. But they categorically said that is not going to be affected. The step 3 will not be affected. But if they use the step 2 to apply for the certification, then it's definitely, the certification is gonna be nullified. So this is how it is, and we all know that USMLE reserves the right to make such decisions, to determine whose exams to hold back, who to issue certificates to, and they reserve the right to do that. That's an absolute right to them, because they owe the responsibility to the US public to provide good physicians who meet the criteria that they have set. Now, in the previous video, I had people ask certain questions, and some of the questions have really struck my mind. Now, one of the questions is, the person is asking that if they really cheated, if these people that they are accused of cheating, if they really cheated, then they are saying that they deserve a complete ban from the ECFMG certification process. So if they have really cheated, then they should ban them totally from taking any future exams, because we know that is one of the consequences of cheating, and it is spelled on their website that if anybody cheats in exam and all that, they reserve the right to completely ban them. Probably they have not reached that level yet, but we will all keep our ears open to see what comes out of this finally. Now, somebody also said that, is it only these students from Nepal who participated in such scandal? Could it be that they teamed with other people, but those people have not been caught? And is it only people from Pakistan? Could it be that there are people from other countries as well? So ECFMG should do proper investigation. And probably for those who know much about this whole thing, maybe they should include them in the investigation and do a better investigation. I don't know your thought about that. Let me know your thoughts on that in the comments below. Just comment and let me know what you think. Now, the biggest of the questions that struck me is that has whoever who is working in the USMLE board who has been tasked, or all the people who have been tasked to protect the sanctity of the exam, have they failed us? Have they failed us, the students? Have they failed the US public? And should heads roll? Or it should just be that they've punished the students and that is it? Or they've punished the test takers and that is it? Because now I think that going forward, they need to tighten the security of the exam. Personally, I don't understand why people taking the exam at the same time should have the same set of questions. That is it's something that I do not personally understand, why people taking exams on the same day at the same time should have the same set of questions. So already they have not been fair to us by giving the same. I mean, that is what I'm making out of this. Because if you look at their email, they are saying that students who were taking the tests and taking the same block at the same time scored the same items and scored very high. It means that they were answering the same questions at the same time, which I think is not fair. Going forward, probably they might have to shuffle the questions in such a way that no two people are writing or seeing the same set of question blocks at the same time. So this is what I have in this video for you. Let me know exactly what you think about this video, what you think about the whole scandal, and how you think it should be handled, how you think it should be investigated, and how you think steps should be taken to correct future mistakes from happening. I'll see you again in the next video. Bye.